Hi guys, this is my Nursing Teamwork and Culture PowerPoint for Management class by Bella Morse. I just want to thank you guys for attending my presentation. I hope to provide you with some opportunities for reflective thinking while you are listening to this presentation. Following the end, just remember to answer the 3 NCLEX questions, as well as complete the survey questions and make a graph. Introduction. What do you know about nursing culture and teamwork? How would you describe the teamwork as on your department? What discrepancies do you see on your floor that could be mended with positive teamwork? So a quote from Nursing Education Staff 2024 states that effective teamwork can help manage workload and reduce burnout. Nursing teamwork and culture is an important component into the daily workflow of the unit. Without the collaboration of the charge nurse, bedside nurses, nurse assistants, and other members of the interdisciplinary team, patient outcomes would not be successfully met. So some learning objectives to help solidify your understanding of nursing culture and teamwork. Viewers will be able to identify methods of teamwork to improve the culture in the workplace. Viewers will learn the importance of developing working relationships with their peers in order to take care of patients effectively. Viewers will be able to understand the importance of communication with the multidisciplinary team to support each other's decisions. So some areas of emphasis in class responsibilities. While listening to this presentation, I want you to focus on these areas of emphasis. The importance of creating a safe and welcoming culture with the members of the care team, showing qualities of effective teamwork to provide safe patient care, and understanding the importance of working together with your coworkers to achieve a common goal. Some class responsibilities. The audience will participate in the online teaching strategies provided during the presentation. The viewers will be engaged in the presentation and come to the presenter with any questions or clarifications if needed. The viewers will take the material presented to them and come up with methods on how to improve their teamwork skills in the workplace. And the audience will come up with feedback based on the information provided to them. So some teaching and learning strategies I used throughout this PowerPoint. Conducting a survey on how department staff members feel about teamwork to assess discrepancies and unhappiness in the workplace. And showing visuals of graphs and charts that describe the correlation between teamwork and positive patient satisfaction. So what is the importance of nursing culture and teamwork today? Nurses collaborate and communicate with the multidisciplinary team to support the patient's needs. Nurses advocate for their patients to come to a common goal, allows for respect to be given and earned with other members of the team, addresses conflict and allows for escalation of needs, and effective teamwork can reduce workplace burnout and increase job satisfaction. So this also allows for shared values in the workplace. How nurses display their interactions with each other, other nurses, other members of the multidisciplinary team, and the patients is very important. We want the patient to be the center of our care. The culture is ultimately shaped by behavior and their commitment to the job, and their patients by following ethical standards, advocating, and allowing all patients to have autonomy. Collaborating with each other is important to allow for a smooth workflow and enhance communication. Being compassionate and supportive of each other and the patients can ensure a positive outcome. So here are some quotes to better understand the evidence-based definition of nursing culture and teamwork. So the 2 main resources I used to make this presentation had some good quotes describing the importance of nursing culture and communication. So the first one is from Nursing Education Staff in 2024. It states that effective collaboration, communication, and decision-making among nursing team members can significantly impact patient outcomes and work culture. Another quote from Bake et al. 2023 states that enhancing nursing teamwork can serve as an effective strategy for promoting patient-centered care. So the article from Bake et al. Had a good survey in it that described the correlation between teamwork and patient care. So patient-centered care is a standard that puts the patient in the center of the care process and prioritizes them holistically. So a cross-sectional analysis of online survey data was collected from 992 Korean nurses who worked in the clinical setting. The survey was conducted in May of 2021. The purpose of this study was to determine the teamwork level of Korean nurses and examine the relationship between nursing teamwork and patient-centered care. The RNs who were surveyed worked in the hospital setting with at least 6 months of clinical experience. The participants were gathered from a work scheduler mobile application and completed it online on their own time. Some questions involved the teamwork dynamics on their units, work-related and individual characteristics were listed as well. So the results showed that nurses that experienced higher levels of teamwork on their designated departments displayed a more positive association between teamwork and patient-centered care. The conclusion stated that enhancing methods of teamwork created a more supportive working environment, ensured better staffing, and improved overall patient-centered care. A quote from Baek et al., the article who did the survey, states that teamwork failures cause more than 70% of sentinel events in the healthcare system. Remember that those sentinel events are unexpected events that can cause serious harm, injury, or even death to the patient. So this is a visual graph of the survey we just talked about on the last slide. So there were 3 different subgroups in this survey: low, mid, and high teamwork groups. So there's a positive correlation between nursing teamwork and patient care among the mid and high teamwork groups, with personal and work-related characteristics as well. So according to Baek et al., 2023, compared with low teamwork, mid and high teamwork increased patient-centered care scores by 0.32. So about 20% of the total nurses are in the low teamwork group, 50% were in the mid, and 30% were in the high. The low teamwork group had the lowest scores overall in all 5 categories listed on the bottom of this chart. So backup, shared mental model, team leadership, team orientation, and trust. We are going to complete a small survey and create a mock graph similar to the one we just reviewed. This will be based on your department and your personal work experiences. No one else will see these answers but you, so be as honest as possible. This is just to kind of help reiterate what we just learned on these last few slides. You can rank each question with a 1, 2, 3, 4, or a 5. 1 is strongly disagree, 2 is disagree, 3 is neutral, 4 agree, and 5 is strongly agree. And this is at the bottom of this slide here. So I want you to take out a piece of paper and write down your number to all of these questions. So question 1, I feel satisfied with the team and culture on my department. 2, I feel as though I have resources on my floor that I am able to utilize, such as managers or supervisors that will listen to my concerns thoroughly and escalate my needs properly. 3, the people on my team get along well and have open, positive communication. 4, each person on my department knows their job role. And 5, I have goals on my department that I am able to discuss with my manager and supervisor. This is an example graph that I created based on the questions that we just answered on the last slide. The purpose of this is to use the survey strategies that we learned from the article and understand the correlation between the nursing culture and teamwork on your own personal department and how you ranked it. This is interesting because each person's graph will look different. I want you to set up your piece of paper to look just like this, except for the pink dots and lines. Based on how you ranked each question with a 1 through 5, you will place a dot on that number along the survey ranking axis on the left. Once you have created all 5 of your dots, you can draw a line through all of them to see the correlation between teamwork and culture on your own floor. Conflict resolution is an important component of team building. So it is important to address conflict. You want to address conflicts as soon as they arise to allow for quick resolution and preventing the lingering of the issue. It's important to resolve right away. Also clearly state the concerns. This helps you to be open and clear and concise about your concerns with the person. Allow everyone to share their side of the story. And make sure each opinion is considered before immediately dismissing someone. This allows all members to feel as though they have a voice and a professional working relationship is still maintainable despite any conflict that might be on the department at that time. So here are some methods to help promote teamwork. Constructive criticism and positive feedback. Not only does constructive criticism help improve someone's skills, but it can allow open conversations and rapport with one another. This can help point out areas for improvement while being open and honest with the best intentions. Inspiring and motivating is also an important component. Setting team goals. This helps make sure everyone is on the same page and allows for personal and professional growth. Goals help each person know where they stand as well. Lastly, recognizing your coworkers' hard work. You want to value those around you. Show them that their contributions help to run a smoother ship and maintain a conducive work environment. So some benefits of communication and team building. Page 501 in our Leadership Roles and Management Functions in Nursing textbook for this class says that communication and team building are intertwined because team building activities encourage trust, cooperation, and communication within a group, and improving communication enhances how workers interact with one another. So this is important for goal building. This helps create mutual goals for the team and roles are more clear. This is also important for building working relationships. Team building and teamwork is an important component of nursing. Effective communication helps with any confusion that might be experienced on the floor, because everyone may be in a different place in their career, and it helps to promote effective communication. Understanding cultures and values is also important for this. This positively impacts the communication with each member's different views, values, ways of thinking, and confidence levels, as well as what their place in the organization is. This is also important for being a good leader. They're responsible for providing structure, fostering communication, supporting teamwork, and confronting conflict and managing that. Lastly, benefits of communication and team building is important for understanding what is expected of you as a member of the team. This helps you to know your role in the organization. So some NCLEX style questions that can help reiterate your learning and education from the nursing culture and teamwork. So question 1, what is an effective way to handle poor communication with a member of the care team? Select all that apply. 1, call the person out over messages in a group chat with other employees. 2, ignore the situation in hopes that communication will improve on its own. 3, speak with the charge nurse and nursing manager to come up with a solution to improve communication. 4, take a short break without alerting anyone else on the floor. 5, escalate the issue by following the proper chain of command. So the correct answer and rationale is 3 and 5. 3, speak with the charge nurse and nursing manager to come up with a solution to improve communication. 5, escalate the issue by following the proper chain of command. 3 and 5 are correct because it is important to maintain professional about the situation while also following proper escalation measures. Question 2. A nurse on day shift is experiencing fatigue and isolation during the shift. She feels as though the patient care is compromised due to the inconsistencies in communication with the care team. What is the priority action for the nurse to take to improve patient safety? 1. Escalate the concerns to the charge nurse and communicate thoroughly with the care team. 2. Put in orders yourself and take on the brunt of patient care. 3. Assume the doctor would want certain interventions to take place, so prepare to do those. 4. Make a note in Epic describing the issue. So the correct answer and rationale is 1. Escalate the concerns to the charge nurse and communicate thoroughly with the care team. Being fatigued as a nurse is unfortunately very common, so bringing up your concerns to your higher-ups is important. Communicating effectively with the care team is one of the priority interventions as a nurse, and without everyone's assistance, the work would not flow as smoothly. Never take on the brunt of patient care, because there are issues that can be delegated in order for you to prioritize your other patients and their needs as well. Never assume the doctor would want certain interventions done. Do not make a note in Epic describing the issues with you and the care team, for the patient's chart is an inappropriate place to have this conversation. Question 3. What is one technique you can take with you to help make positive contributions to the nursing culture on your department? This is a short answer question. This is the way I would answer this question. To improve nursing culture on my floor, I can clearly communicate my needs with the necessary members, as well as show my appreciation for any assistance I may receive. I can also make shout-out recognition posts for anyone on the care team who assists me with a task. Lastly, I can join a unit council to help plan team bonding activities to develop closer relationships with my fellow team members. The learning objectives, as mentioned previously, should be more well understood after listening to this presentation, so viewers are able to identify methods of teamwork to improve the culture in the workplace. Viewers learned the importance of developing working relationships with their peers in order to take care of patients effectively. Viewers are able to understand the importance of communication with the multidisciplinary team to support each other's decisions. Some areas of emphasis that viewers now know covered about nursing culture and teamwork include the importance of creating a safe and welcoming culture with the members of the care team, showing qualities of effective teamwork to provide safe patient care, and understanding the importance of working together with your coworkers to achieve a common goal. Thank you guys once again for listening to my presentation. I hope this provided you with some insight into nursing teamwork and culture. I hope that by practicing those 3 NCLEX style questions and completing survey questions and making your own graph kind of helped to practice and visualize what it can look like when you have good nursing culture and teamwork on your own department. If you have any questions, just let me know. Thank you again for watching. These are the references I used throughout my presentation. I have 2 references I found on my own, and I referenced the textbook once in this presentation as well.